Thank you very much, Dr. Zhao. Thanks for your wonderful report, and we certainly are inspired by your words, and it is good to be young again. Well, on behalf of the NAM National Governing Council and today's program committee, I wish to welcome all our members and guests attending today's very exciting program. As Dr. Zhao mentioned, being a council member and also a dean of a medical school, I am well aware that the voice of the National Academy of Medicine carries loudly across this nation. No other organization holds the same stature in the minds of many groups throughout the nation, including professionals, government officials, business leaders, and the general public. Each person here today, no doubt, has achieved much in his or her career. But when we work together, we actually form a formidable force with a palpable impact on human health and well-being. We have influenced, as you've heard this morning, healthcare and health outcomes in the United States and around the world. Some of our influence also extends beyond our borders, impacting the lives of women and infants in developing countries in far corners of the world. Today we will discuss the overwhelming challenges our society faces with an aging population that is rapidly upon us. I believe our evidence-based reports and policies resonate positively in our society because our goal is not to promote an individual agenda or an organizational agenda, but rather it is to improve the health and well-being of the nation and beyond. I believe I can speak on behalf of our committee and certainly the council that we applaud President Zhao and his entire leadership team for their hard work, their excellent leadership, and the invaluable service that we collectively provide to our nation as advisors. As Dr. Zhao mentioned, it was my privilege to serve as chair of the program committee. It was a collaborative effort, and the results of our combined effort will be shared with you in a moment. But I too want to give credit to those colleagues with whom I worked, Drs. Adler, Blazer, Greider, and Larson, and Gilloman. It was a very energetic and deliberate group that really resulted in this effort. It was wonderfully collaborative, and I want to certainly give them thanks for their collaboration and for their efforts. I want to particularly also recognize the senior staff members at IOM with whom we worked. This work would not have been possible without their efforts and collaboration. I want to recognize Clyde Bainey, the executive officer of the NAM, and Lauren Shern, the program specialist. Lauren was particularly helpful in facilitating all the calls and all the emails and all the conference calls, and did it all with a smile. So let me ask us to give special acknowledgement to the NAM staff for their efforts. When we were given the charge to identify a topic for this year's program, as a committee, we knew that we had to choose a topic with at least some of the following attributes. A topic that had national relevance and national impact. One that the National Academy of Medicine's expertise could help to illuminate and thereby have an impact on the national agenda in this area. Over the years, we have addressed many issues that fit this description, but one which is as inevitable as death and taxes has remained unexplored, and that is the topic of aging. I should mention parenthetically that many of us on the committee, and I suspect many in the audience here, have a personal interest in the topic for the day. Quite fortuitously, the World Health Organization issued a World Report on Aging and Health quite recently. This report outlines an action plan to promote healthy aging. In this report, the WHO estimates that by 2020, the number of persons aged 60 or more will outnumber the number of children less than age 5. The WHO also projects that by 2050, the number of people age 80 or more in China alone will be 120 million persons, and that will exceed those aged 80 or more in the entire world. Yet, as the WHO report highlights, little is being done now to prepare our society to handle this dramatic change. Just think of the demands of the older Americans and their families. For a moment, let's reflect on that. When we think of Medicare spending per capita, that triples after age 65. When 1 in 6 Americans will be paying more than $100,000 in out-of-pocket expense for their health care. In contrast, the Social Security benefits is only a fraction of that cost. Those numbers are staggering. The challenges they present is even hard to fathom. Now, while the WHO reports examine the issues around aging from a public health perspective, the National Academy of Medicine has unique expertise and contribute to the global discussion from a variety of perspectives. Today's program will examine aging from biological and biochemical perspectives, as well as sociological and societal perspectives. For example, today we'll explore whether there is something different in the genes of centenarians that allow them to live long and healthy lives. We'll also discuss what can go wrong in the aging brain. Our program is intended to provide thoughtful conversation on a range of research issues surrounding aging. Therefore, we'll address today 4 main areas in our discussion that will proceed momentarily. The first will be a thorough discussion in the biology of aging and that which we know to this point. Secondly, we will discuss in some depth aging, cognition, and frailty in our second session later on. Our third session will cover the aging society and the impact that is having. And we'll conclude the day with a President's Forum dedicated to innovation in aging and longevity. The moderators and panelists joining us today are truly national and international research leaders in their respective fields. So one thing I can guarantee you, and that is today's discussion will be lively, it'll be interesting, it'll be educational. And so I'm just delighted to see so many of you here joining us to participate in this discourse that we'll be having. So thank you very much for coming. Now it gives me great pleasure to introduce to you our keynote speaker. As listed in the program, our keynote speaker is Dr. Laura Carstensen, and her full biographical sketch is in the booklet, so I will simply indicate a few highlights. Dr. Carstensen is an international expert on aging, best known in academia for socio-emotional selectivity theory and the lifespan theory of motivation. She not only comprehends the challenges of the elderly and its effects on the body, but also how we can improve the well-being of those among us who are blessed to be above age 50. As the founding director of the Stanford Center on Longevity, Dr. Carstensen has been, as her students and colleagues, exploring innovative ways to solve the problem of older adults, as well as how we can improve the health of people of all ages. Among her numerous awards, Dr. Carstensen has received the Kleemeyer Award and the Distinguished Mentorship Award from the Gerontological Society of America, as well as a Guggenheim Fellowship. In 2011, she authored a book entitled Long, Bright Future: Happiness, Health, and Financial Security in an Age of Increased Longevity. Most recently, she participated in the TED Radio Hour episode entitled Shift in Time. Ladies and gentlemen, please join me in welcoming to the podium our keynote speaker for the morning, Dr. Laura Carstensen.